So without further ado, Georgia, you are our first official guest of our new monetized channel.
Oh, awesome. I'm so honored. And I do apologize for being early. I will have to admit that I saw somebody tag me on Facebook saying, watch Georgia Davenport live right now. And I was like, oh my God, I'm supposed to be on there. And then I just looked at the time when you guys said that I'm really punctual. And I was like, oh my gosh, I'm 15 minutes early. So if I'm too early, I'm happy to step away. And
we're kind of egotistical here, and we have like a certain way we got to do things. So you can stand aside and hang out in the lobby for about 20 minutes, and we'll call you in when we're ready.
We're pretty casual and just go with the flow. Like we have a couple of things that we'll do, but we could go in whatever order.
Yeah, we would just ask that, if anybody is watching right now, especially on Twitter or Facebook, make sure that you're watching on YouTube, and make sure, Georgia, if whoever's
who does your Twitter for whole Washington.
Yeah, the Red Brigade. If you can hit the retweet button, and all that, to try to get as many people on here as possible right now, and we're going to keep sharing. But this is a very important conversation because it is something that I think it's got a lot of potential. Because as I'm sure you will explain, Georgia, this is something that's being spearheaded by nurses. Is that correct?
Yeah, our chair is a nurse, and the person who co-wrote the initiative is a nurse. So we have a lot of healthcare professionals in our organization, and we really wanted to be led by healthcare professionals when we started out. And that was, I'm getting some echo. Are you hearing that?
A little bit.
I think you may want to just turn your volume down a little bit, but it's actually not an echo. It's just a very, it's a loud projection, which is perfectly fine, but it's all good.
Okay, I'll try to back up too. Sometimes I get really excited.
That's better. Whatever you did made it better.
Okay, yeah, I think I was talking too loudly into my computer, getting very excited.
And just to confirm, it's wholewashington.org, is that it?
That's right.
All right, beautiful.
And I want to give a shout out to Jason Call, who's running for Congress.
He's on here. He's already saying you were in your committee meeting today. He's already on here.
Him and Jen are buddies, so that's a good thing.
Well, speaking of which, I know that you were a candidate.
Mm-hmm.
Talk about that. Talk like when that was and what your background is, and before you came into whole Washington.
Well, that's a big subject, but I got re-inspired to be part of the political, fun when Bernie Sanders announced his run for president in 2015. I kind of checked out of politics. I was a anti-war protest organizer in Albuquerque, New Mexico, but no matter what we did, we didn't stop that war. Mm-hmm. So I got a little cynical. And then when Bernie Sanders, who was one of the few politicians who stood up against the Iraq war, announced that he would run for president, I got re-inspired to get involved. So I became a PCO, which is it's a precinct committee officer here in Washington State. You get to vote for your local LD board members and that sort of thing. Right. I volunteered for Bernie Sanders. I actually went to Philadelphia as a super volunteer for Bernie Sanders, where I got to drive Susan Sarandon to the convention and Danny Glover to different hotels for different meetings. So I got pretty involved. And then again, I got a little cynical after everything that happened in 2016 happened. And I started learning about initiatives because the initiative process was really exciting to me. It was direct democracy. A lot of the times when you support a candidate and they get elected, they have that's a tough job to do, and to pass something like Medicare for all or universal health care. You have a lot of challenges when you're an elected official to get things like that passed. But initiatives, they're direct democracy. You collect the amount of signatures you need, you get the ballot, and then the people can vote for them. So that was really appealing to me. So I started working for Initiative 735, which was the initiative to overturn Citizens United here in Washington State. We won by 64%. Ooh. And we kind of started thinking about what we wanted to do afterwards. And healthcare was our number one priority for many of the staffers and the volunteers for that initiative. So that's how we joined. That's how we created Whole Washington. It was to be a ballot initiative. And we ran a ballot initiative in 2018. 100% volunteer. I was the campaign director. I was volunteer. I didn't get paid. I just, I'm really passionate.
If you want to be in progressive politics, you better be willing to do it for nothing.
No, today is our very first day of being paid.
Yeah, we got $2.
We got
$1.70.
Well, yeah, there you go.
There you go.
Thanks to Josh. There you go. Big day.
That's great. And that's through YouTube?
Yes.
Yeah, just about. Like if we could figuratively hang the dollar bill up on our wall, we would, but it just doesn't work that way anymore.
Well, that's really cool. I mean, I knew that you could monetize YouTube channels, but I never thought about doing it for progressive podcasts. That's awesome.
It's not easy, and it takes a lot of people. Like, we had to get to a certain amount of viewers, a certain amount of viewing hours. Like, they don't make it easy.
No, but we were given a tremendous boost just a couple of weeks ago by Vosh. We were, and look, we did get a boost from Tim Pool. Tim had Jen on, a couple of months back, and we were very grateful for that. But Vosh just completely put Jen over the top. And it was, look, people,
it's fortuitous.
It's kind of the thing, with the whole movement right now and everything that's been going on since Force the Vote, and, recognizing that so much of what the left's success will be about is lifting other people up that maybe are not as necessarily at that same level that you're at. And very often, like in anything, we all know how bad the corporate media is when it comes to just punching down. I think people on the left are guilty of that. I think if we're ever going to get to a single payer healthcare system, everybody has to check their egos at the door. They have to do it. There's no other way.
It can't be about candidates. It's always about the purpose and the mission. But what I wanted to ask, I looked at the organization site, and I get that you support single payer on every level. But what I'm interested in is sort of the what's included in your state bill that you're pushing for, because it looks really amazing. And to me, that would be exactly what we would want to see at a national level. So if you could just talk a little bit about, what it entails in terms of, people think, oh, it's just Medicare for everybody. Well, it's not that simple. There's a lot more, and it includes things that Medicare doesn't even include. So could you just talk about what is included in Whole Washington's plan?
Yeah, that's kind of the tricky thing about when you talk about Medicare for all, is a lot of people are like, well, Medicare is not that great.
Right.
And I just want to clarify that when you say Medicare for all, it's not Medicare as we currently understand it. It's actually a single payer system, no copays, no deductibles, covers, healthcare, obviously, and vision and dental. It allows the government to negotiate for better pharmaceutical prices and that sort of thing. So when we formed Whole Washington, like I said, I'm a huge Bernie supporter. So one of the things we wanted to do was look at his Medicare for All bill and Pramila Jayapal's Medicare for All bill, and model our system, because we felt like that was the ideal system, model our system after it. So it's got a lot of similarities to the national bill. We don't call it Medicare for All. And one of the reasons why is because, well, first of all, Medicare is a national plan. But also, I don't like to have to go through that explanation when somebody goes, Medicare only covers 80% of, and I have to get all these supplemental plans. It's not great. Then I have, that's not actually, we're not talking about that. We're talking about something better. So we call it universal health care. I think that's clear to most voters when you're talking to them what that means. So that's what we call our plan, but it is very, very similar to the national plans.
That's awesome. And I know that nationally, they have it, I believe, is it a 4-year phase in, how it's done, and how it starts opening up to, different groups of people?
Yeah, I think the Senate bill is different from the House bill in that respect. Bernie's bill has a longer phase in, and Pramila's bill, I think, is a little bit shorter, but I'd have to look and see the differences between those two. There are a few differences between those bills, and that's one of them, is the phase-in.
Okay, so talk about what your timeline is in terms of getting this through, because I did see that was posted on your site. I know that you are not just talking about this, that there is an actual plan, which is why this is really cool. This isn't just, a bunch of people talking about something. So would you talk a little bit about what your timeline is, what you're trying to accomplish to get this plan through?
Yeah, so we actually have a bill in the Senate right now with 7 sponsors, which is more than twice the amount of sponsors we've ever had for our Senate bill, which is amazing. But something interesting happened we were very, very excited. We were the only universal health care bill, and it looked like the pressure campaign we had for certain elected officials who refused to ever let these bills out of their committee. It was working. It seemed like it was working. Lots of people were making calls, sending letters, asking them to let this bill have a hearing and let it out of committee. Well, a week ago, somehow a new universal health care bill that is only 4 pages long, and it creates a commission to look at how we might eventually in 2026 have a single payer program planned and passed, and maybe who knows how long that plan will take to implement. So really they created this new piece of legislation to kick that can right on down the road, because I feel like for the first time we've actually done letters to the editor. We've been published 3 times already. I feel like we were really, really making some inroads, and they were feeling the pressure. And this is their way to kind of combat that. Is and even more background to that, they just passed a study last session that took 18 months, and they decided not to do any recommendations after that study. So it's been kind of a frustrating day, and I want to shout out to all of our volunteers who went to the hearing for that commission bill and told them, the healthcare committee, that we don't have time to wait. People are dying. They're going bankrupt. They're cutting pills in half, rationing insulin. And they're going to say, let's wait till 2026 to introduce a bill when we have a perfectly good piece of legislation we can pass this year.
But you can also do this through a direct ballot initiative, right? So, I mean, this is something that you're approaching from a few different angles, which is what I always think is the smartest way to do anything.
Yeah, nothing's off the table. We're definitely gearing up. We have, the last I checked, about 800 volunteers who have pledged to collect more than 200,000 signatures. So that's awesome. And that's something an initiative campaign really has never done before, is have a bunch of pre-pledged signatures. So that's, we're off to a good start. The only problem is that, well, there are a few problems. COVID-19 makes it really, really difficult to collect signatures in person, which is required by state law here in Washington. We have to collect 350,000 signatures. And usually the way you do that is by going to big events like rallies, concerts, Folk Life Festival, which, you know, about 200,000 people. Yeah. So it's difficult when you don't have those big events to attend. And also money is a problem. Whole Washington's a grassroots organization. We rely on grassroots donors. And printing petitions is really expensive. It's about $1 a petition, and there's 20 signatures per petition. So if you do the math, we're talking about tens of thousands of dollars to print enough petitions to get these signatures.
Well, we'll do what we can to help you, because this is a cause that, you know, I mean, at some point you just have to put your partisan politics aside.
But I will say, if they get healthcare, I'm moving there. They already have recreational weed and death with dignity, and that, honestly, those are like that's like a 2 for 2 for
but again, you're talking about, this is one of the reasons why they try to stop it from happening, is because if Washington State became the first state to pass, a single payer healthcare system, they'll have like 5 million people trying to move into the state. They're going
to have an immigration problem.
Yeah, well, yeah. I mean, whatever you want to call it, but it would be, and I still think that's probably one of the reasons why it failed in California, even though everyone wants to, of course, point the finger at one person. What have you learned from the experience of seeing, Amendment 69, Colorado Care fail in Colorado, and then, of course, California attempted to do it at the state level across the board? What have you found have been the things that perhaps maybe California and Colorado did not do well, that you're looking to make sure that Washington does better?
Well, Colorado has some interesting issues with their ballot measures. The first, and probably the worst thing for them, is that they had to put in the very first sentence of their ballot summary exactly how much it would increase taxes for 10 years, but they couldn't say how much it would save. So right away, a voter is like, wait, I mean, and I'm making up a number. I don't know what the exact number was, but wait, this is going to cost $20 billion. But, they don't say, but currently the state of Colorado is paying $30 million. So it'll actually save $10 million. They weren't allowed to put that. So that was the big issue. The other issue is they had from like the 1960s, it's still on the books, saying you can't spend any state money on abortions. So Planned Parenthood came out against the bill because they were afraid that it would restrict access to reproductive services.
I have been and I've made enemies for saying this, and that's too effing bad. We can't curse now, so we have to be cognizant about what we're saying. One of the biggest impediments to single payer healthcare in the United States is Planned Parenthood. If you don't like hearing it, too effing bad.
And I've always said, first of all, I was a volunteer for Planned Parenthood for years, from when I was in college through when I was living in Indianapolis. I was a Planned Parenthood volunteer. And I do think that there was definitely a purpose for that. And I know that it has saved a lot of people's lives. So I don't have a beef with them, but they are an impediment to single payer healthcare. Whether or not people want to hear that, that's just a fact.
Yeah, if you're a special interest group and you have what you have, then, and again, the CEO of Planned Parenthood makes over $1 million a year, or the president, whatever Celia's Richard's title is specifically. But yeah, I mean, we're fighting for everyone to have health care, not for people to sit on a board, get paid money, and tell you that the other side is trying to take away your right to get an abortion. I mean, not that it isn't significant, but if you had single payer health care, you would be able to get access to an abortion everywhere. So, again, I digress.
Well, and I actually volunteered with NAREL too. How's my internet? I feel like it's glitchy.
A couple of times it was, but it's fine. You're coming through. Okay. It's good.
We can see the battery in the background.
I'm in rural Eastern Washington, so I have terrible internet. I'm going to try to go on my phone and do tethering so that it's better. So if you guys want to talk while I try to get that figured out, I really apologize for this. This is
there's really nothing wrong with it.
It's fine though. It's not bad.
If you insist that it's going to be better, then that's perfectly fine. I have no problem with that.
It's all good.
Okay, well, if you're not noticing anything, that's fine. Just sometimes you guys are freezing up. So, I voted, or I volunteered for NAREL, and we just wanted to make sure that wouldn't be an issue for many reasons. Also, it's the right thing to do. So abortion services are definitely covered in our bill. And we don't have that problem like Colorado has, where you have to put how much it costs. And actually, we've done polling on our initiative, and we've talked to the Attorney General about ballot title and summary. So we're really working on making sure that we don't run into the same issues that they had in Colorado.
So what has been the reception from any of the elected officials? Obviously, Pramila is one of the best federally elected representatives we have in the country. Kshama Sawant, obviously, goes without saying, has been a tremendous representative for Seattle. I am not a fan of Patty Murray for obvious reasons. And I think you could probably talk more about some of the other elected officials, not just Senator Murray, because they are obviously, they take corporate money. And if you're taking money from private insurance and big pharma, you are not going to support single payer. It's that simple. It's a very cut and dry issue. But I also think, and correct me if I'm wrong, but I do think that the fact that Seattle and Vancouver are so close to one another, and the access of crossing the border and being in a country within a few miles that has universal health care, I would like to think that has some degree of effect on the way people think about it, more so now that it's become a more common talking point. If you can talk more about those two particular topics, about where the narrative is going in a city like Seattle or Tacoma, and then, of course, where are the statewide representatives and, of course, the federal representatives when it comes to the single payer issue that you're pushing right now?
Well, I actually have moved across to the other side of the state, so I'm in Eastern Washington. So I'm not sure exactly what is happening in Seattle right now, but I can tell you when I was living there, we got a resolution passed with Kshama Sawant's leadership. A resolution passed to endorse Medicare for All, Pramila's bill, and it specifically called out Patty Murray and Maria Cantwell to co-sponsor it because they've historically never co-sponsored Medicare for All. Now, also, they even voted against that pharmaceutical bill that would allow the U.S. to import cheaper prescription drugs from Canada. And their excuse was, well, we don't know if they're safe, despite the fact that those prescription drugs came from the United States, went to Canada, and then just come back. So it's pretty clear that they're beholden to pharmaceutical companies and for-profit insurance companies. Now, we do have 2 co-sponsors of Medicare for All in our state, despite we're being like the progressive state, like liberal state. We only have 2 co-sponsors of Medicare for All, and that's Pramila Jayapal, of course, since it's her bill, and Representative Adam Smith, who, by the way, historically refused to get on board with it until he had a progressive challenger, Sarah Smith, who you might know.
Mm-hmm. We know her.
Yeah. So I think it's really important for people like Jason and Jen and Sarah to step forward and challenge these Democrats who have historically refused to take action on a bill that it would save so many lives, like 30,000 American lives per year, to try to push them to the left and hopefully win. So, and then I forget what your second question was.
That's okay. I was asking
Do you have any Canadian influence?
Yeah,
like, what's that like in terms of the vibe there and what people have an expectation or understanding of what universal health care is?
Yeah, I think that the old talking point of Canadian wait times doesn't really work here, as well as it works in other parts of the country, because we have so many Canadians who come and visit all the time and tell us, no, that's simply not true, and we love our system and would never, ever trade it in a million years for the horrible system you have. So, and Tommy Douglas, who, I don't know if you know the history of the Canadian healthcare system, but they actually passed single-payer healthcare province by province, starting with Saskatchewan, and with Tommy Douglas's leadership. He's a national hero for helping start that plan. So, and we hear that from them when they come down and talk to us about it, and they're like, "Oh, universal healthcare, Tommy Douglas, single payer." So I feel like because of that proximity, like you're talking about, people don't buy into those scare tactics. And I don't know if you have read Wendell Potter's book, Deadly Spin. He was like the head PR person of Cigna, and he talks about how he actually helped create some of those like bad faith narratives to prevent people from supporting single payer, Canadian wait times, and your taxes are going to go up, and all of those sort of false narratives are created by these insurance company PR people so that they can get Americans to vote against a policy that would help us.
Yeah, I always say that the easiest way to explain what single-payer healthcare would look like, as much as people are, they've been convinced on 2 fronts. One, there's, as Jen likes to say, there's this battered spouse syndrome problem that a lot of people have. They don't believe they're entitled to anything good. And when you get a piece of, like a piece of bread, a crumb, if you will, that you should just be thankful that you got that, and that's all you're worthy of. The rest is up to you. Then the other component that I don't think really gets talked about enough is the real, I would say, the real caveat to our system versus any other system in the world is we have a for-profit middleman system in place to siphon money away from what it should be between you and your doctor. There is no reason for it to exist. They do absolutely nothing to improve healthcare outcomes. They are literally robbing you blind and leaving you dry. There is nothing that Cigna, Aetna, any other company you could think of, Florida Blue, United Healthcare, they have no reason to exist. None. And if you work for that company, I apologize if I'm offending you, but there are plenty of other things that you can do besides some type of an administrative role. There's other administrative roles. Thousands of companies.
I can't think of actually, when you're talking about people that are administrative paper pushers, and I can't think of a job that could more easily be translated into doing that for any other industry. Like I don't understand. And I do think people will lose their jobs, and I think other people will gain jobs. And I think that that's just part of progress. And it's, you do the best you can to accommodate as many people as you can. And that's just the way it is. It's, yes, there's going to be some people that lose a job. But there should be enough other things simultaneously that are opportunities for them to find a job.
And a great example of that is obviously most people that are obviously advocates for single payer healthcare, I assume, are big advocates for the environment as well. And as we saw, the Keystone XL pipeline did get shut down, but there were a lot of people that are now left without a job. Well, how long have we been waiting for an infrastructure bill in this country? At least a decade.
Yeah.
We should be spending at least one, if not at this point, probably $2 trillion on an infrastructure bill centered on clean energy jobs that ensures that there is obviously a thriving economy. And that could happen. But the reason it doesn't happen is we basically have three conglomerates that run this country: big agriculture, big oil, and the combination of big pharma and private insurance. That is what runs our economy, or at least it's what runs Capitol Hill. And until people recognize that this is the problem and this is why we don't get what we need, it's not going to stop. So electing representatives who are not bought by the corporate special interest dollar is how we're going to ultimately get there, even though we've just started to build that momentum. I know a lot of people are impatient right now. They don't think that people like AOC are doing enough. I get it, but we've come a long way in the last 5 years. The fact that single payer healthcare is now a common term that people talk about on the regular, it's like, yeah, we really should have universal healthcare. Well, now the question is, what is the right tactic in order for us to get there? So what can we do, even if we're not in the state of Washington, to help you guys further your message and hopefully get what is necessary for it to be done?
Well, that's an excellent question, which I love to always answer. But before I do, I want to address one of the things that you were just talking about, which is people losing their jobs. Whole Washington Health Trust, just like the National Medicare for All, has a 2-year retraining program inside it. So anybody who loses their job because the bill gets passed will be able to be retrained and hopefully be an integral part of our better medical system because of it. And also a lot of nurses and medical professionals are sitting in offices dealing with billing issues instead of helping patients because of the huge administrative overload of this for-profit insurance system that we have. So I think that we would see a lot of people in a lot more rewarding jobs and happier as a result. So if you're in another state and you want to help Whole Washington, of course, follow us on Facebook. We're on Facebook, Instagram, Twitter. We have great products on our website. We even have hand-knit Bernie mittens right now, inspired by...
Really cute. That's really cute.
We have a lot of amazing crafters like Laura Fielding, who makes these red berets, and you can buy them on our website. It's a great way, like if you're going to go out to marches, which eventually, hopefully, we can go to marches again. You can wear these red berets with little buttons on them to show that you support Medicare for All. We have bumper stickers. And of course, if you just want to donate, because like Canada, I feel like if we get one state, I know New York's very, very close to passing single payer, and we support their efforts too. We don't feel any competition, by the way. Whole Washington just wants one state to go. It's Canada.
But that's all it's going to take.
And I think that the problem is a lot of people will look at this and say, oh, but that's just Washington. But people, you have got to understand that it's one small step for Washington, one large step for the rest of us. Like, it's a big deal because that just puts it on the table. It really does. So I think people, it's really important. So check out Whole Washington for sure and help if you can.
No, you definitely want to get involved in does New York have a specific name for their organization? I mean, the good thing about New York is that they're really building quite a progressive bench, not just at the federal level, but at the state level as well. So much so that Chuck Schumer literally is, crapping in his britches, if you will, because it's not.
We're going to be the last.
I mean, he's the one. Well, yeah, but you know what? Power concedes nothing without demand.
Will be the at last. See how it's almost, with the exception of Alaska, this is like geographically very symbolic of where healthcare, how it's going to flow through this country, being that you're in Washington and we're in Florida. That'll probably be we'll be the end. We'll be the tail end of that.
Well, we are the appendix of the United States. So it's, we're obviously the most useless. That's a
nice way of saying.
Well, it is. I could have said it worse, but I got to mind my language now. So appendix is not a vulgar word as far as I know. But I think you know, we're unfortunately, and this gets back to, you know, like a lot of people in the country. I was in Philadelphia as well in 2016. I actually was, that was when I met Nina Turner for the first time. And I was within a few feet of her when she gave her speech at the People's Convention. I don't know if you attended that or not, but when she wrapped her arms around Jill Stein, I said, uh-oh, that's trouble.
That's not going to play well.
Yep, that's going to be a problem. And it was. They don't want us to figure out how this game is played, which is kind of why they're doing all the things that they're doing right now. They're demonetizing a lot of channels that are putting out the message about things like single-payer healthcare. But I think a lot of people are becoming intolerant of the censorship, and that's on all sides. I just think we're reaching a point now where people are really starting to get how this game is played, and they know that they're being screwed. They're just not really sure how it's being done. It's a lot easier to just cast everybody in a very negative light and say that everybody's a racist or a bigot or a misogynist and all that. And as Jen and I like to talk about, you know, we did go to Trump's rally here in Sunrise a little over a year ago, and I can assure you that the crazies in Trump land, they exist. They're only about 5 to 10% of who actually shows up. So they want you to believe that everybody is irredeemable, but the truth is most of them are redeemable. As you know, in the state of Washington, it's basically, you know, you have the northwest corridor, excuse me, of the state, and a lot of Washington is very red
and rural. Oh yeah.
But I'm willing to bet that most of the people that you encounter in Eastern Washington, they probably share a lot of similar sentiments when it comes to issues like healthcare, the environment, and a living wage. What has been your experience being in that part of the state, which is perhaps not what gets talked about too often when you think about Washington State?
Well, you know, it's a lot of my neighbors. I did run for state legislature. I believe you asked me about that. I totally forgot to talk about that. But okay. In 2020, I ran for state legislature. It's very red. I got 30% of the vote. So I was happy with that, especially since I haven't lived here, you know, my whole life. But yeah, I mean, it's all about finding that common ground when you're talking to voters in a district where maybe you have some pretty big differences in opinions in some areas. You can talk to them about healthcare because that affects everyone, you know. And actually, my opponent, she had this great bill that got passed. She's a Republican, but she had a bill that got passed that regulated the price of insulin in Washington State because her son is a diabetic, and she realized, I'm not supposed to cuss, but
good. Yeah, it's all good. All good.
She realized it's really way unaffordable, the price of insulin. So it's when it affects people, right? And you need to be able to have those personal conversations with them. Like, how much are your premiums? How much are your deductibles? Wouldn't it be nice if we went to a system where you wouldn't have to worry about out-of-network costs, out-of-pocket costs, you know, or cutting your pills in half? And we've had people just recently in Bellingham, we had a couple they were older, they did a murder-suicide because they could no longer afford the wife's prescription. So, I mean, stories like that are coming out of rural Washington. And here, I have Life Flight go over my house very often, sometimes twice a day, because all of our providers are closing. They can't stay open because Medicaid and Medicare reimbursement rates aren't high enough. And insurance companies are like, we're not insuring people in rural areas. It's just way too expensive. So hospitals are closing. Providers are shutting their doors. So when somebody breaks their arm, guess what happens? Or gets in a car accident? The helicopter shows up to take them to the nearest provider. Tens of thousands of dollars for these helicopter trips. So people in rural areas are hurting. They're experiencing the pinch probably more than in urban areas. So if you can just communicate to them about how we can develop a system that would be so much better for all of us, I think that's where you'll have the impact.
We always did that. I mean, we always focus on issues, and that's the key thing. And you agree with whatever you agree with on whatever particular issue. That's your team for that issue. You don't have to agree on everything. We don't have to. You don't even have to be friends, but we can be productive. And I think that that's really important. And I do like that you don't call it Medicare for all. I think that's smart. And I generally say single payer, but that also is confusing. So, but then I feel like when I say universal health care, that the people on the left think that that's kind of like a wiggle wormy word for getting out of what they say is single payer. So, I can't win, basically.
It's really hard to win. It's really hard to win. I mean, and we have this debate all the time in whole Washington, like what is universal health care? And I feel like it's the same thing with Medicare for all. It depends on who is saying it.
Yeah.
Like we had a person run on Medicare for all, Dr. Kim Schreier in the 8th District. And she would say, oh yeah, I'm for Medicare for all. It was even on our campaign website. And I would confront her about it. I'm like, are you going to co-sponsor the Medicare for all bill? Oh, no, I have my own bill. So it's all about who says it. Like, when I say universal health care, I mean like nonprofit, publicly funded, what Canada has, but better even. But, if somebody else who's maybe a more centrist or moderate says universal health care, you should probably be curious about what that entails.
Exactly. So that's the problem. So it's like, until we have a state initiative that has a name like Whole Washington, I'm kind of at a loss.
And I think that having that name is very key. I think you did an excellent job. I do sales and marketing for a career. So,
oh, yes.
Just the whole, red, obviously the apple, everything. It's very smart. It's very, and again, red is usually associated with nurses anyway. So that's a really good thing.
Well, I wanted to ask you about that because I find it very important to distinguish for people that this is in no way related to or affiliated with the pink hat ladies. And I'm not even going to say the V word because now I know that apparently we can't say the V word. Yeah. Somehow that's not okay. So anyway, but do you know the story of where the red, like where the red beret, like where it started? Because I know where I got this one. I have my own whole sentimental sort of story for it, but I want to encourage people to support your organization, buy the red hats. And for my Florida people who I'm sorry to say, we don't have a use for this. It's already going to feel hot in here in a few minutes just from having this on my head. Feel free to buy them for friends who live in cold weather places. That was the story. But yeah, if you could tell what that is, that would be great.
Yeah, so Laura Fielding, who's the executive director of Red Berets for Medicare for All, came up with this idea when she saw all the pink hats at the marches. And I think she was like, well, what does that stand for exactly? We need to get an issue, something that will actually create fundamental change in people's lives. And so she started knitting Red Berets, and I met her, 3-4 years ago. It seems so long. And she talked to me about this idea she had, and I thought it was just fantastic. And so we've been good friends ever since. And I saw that she had a question about whether or not she should knit one for Senator Annette Cleveland.
Yes.
So Senator Annette Cleveland she's one of the healthcare chairs she's the Senate healthcare chair here in Washington State. And she takes a lot of money from for-profit insurance companies and pharmaceutical companies.
She's not going to wear that beret.
She actually said in the testimony today, I hope you knit me a beret. Well,
yeah, vote for our plan. We'll even throw in the hat for good measure.
Yeah, really.
We'll get you a few. What was the woman's name who sent me this? I keep forgetting.
Was it Laura Fielding maybe, or Michelle?
No, it was like, what was her name?
Fran?
Fran, yes.
Fran.
That's it.
So this was right about like the time that we launched our campaign. I think I even got this on the day that we launched our campaign. It came in this envelope and there were 2 hats and 2 Bernie buttons from Fran. And I was so excited. I thought it was the coolest thing ever. And by the way, it's warm here. And I wore it anyway. And we had an outdoor launch and I wore it. But the coolest thing now for me about it is the second one, because she sent me 2, I gave to a dear friend who was such an advocate for Medicare for all and a fighter for Fight for 15 and just someone. And he died recently, somebody that left like our local progressive movement left a big hole in it. And he was the one who had the other hat. And so
and he loved it.
And he loved it.
Yeah.
And I gave the day that I got the 2, I put one on and I put the other one on him. And it was just really, it meant a lot to me. So anyway, now when I wear this, I think of that too. So I have a fondness for my red hat.
Well,
No.
that's one of the things I do love about Washington is we have a lot of these crafters who we had somebody who made us custom hats with our logo on it, just like amazing things that people make for our campaign because they believe in it. So I do love that about working with this organization is people have the most creative ways of helping out.
Now, we talk about the language that is used to try to attract people's attention and make sure they understand. I find that the biggest rejection from people on the right is they don't want government-run healthcare. Is what you are proposing government-run, or is it government-funded, state government-funded? How would it work exactly, the distinction?
Yeah, and that is one of the things that I ran into a lot on my campaign is I say universal health care, and the immediate reaction from some is, oh, I don't want that socialization or socialized medicine. That's what I hear all the time.
Yep.
And it isn't because it, like you said, it's privately delivered, publicly funded, just like Canada. So NHS is one of the only ones I can think of. Well, we do have in the United States, we do have socialized medicine, actually. We have TRICARE, and we have the VA, and we have IHS. So we do have examples of actual socialized medicine here in the United States. But the whole Washington Health Trust and Medicare for All is not socialized medicine. It allows doctors and providers to still remain private.
Yeah, I think that's a key thing. How can people help?
Yeah, how can people help? If
Put
there's
the website
a way,
back up.
I'll get the website up
And
again.
social media handles and whatever we can do.
Yep.
Yeah. And, whatever we can do to help spread the word. Obviously, money is helpful, people. I don't ask for money. Well,
get used to it if you're
I
ever
hate
going to run
it.
again.
No, I can't do it. That's not somebody else's
She doesn't
job.
want to. She doesn't understand that if she's going to run again, you have to ask for money.
I'm not asking
Too
for
bad.
money. No.
Then don't run.
And you ask for money.
I'm not the candidate. You are.
That's why you get a good campaign director that's comfortable with it.
That's somebody else's job.
Yeah.
You go up, you make a great speech, and then the other person says, "Okay, so now's the time."
Everybody, jump on!
This is
You got to
your-
ask money.
see,
Yeah,
and
that is
that
my
makes it
money.
be more your job than my job.
Well, I fundraise for a living, so I guess
There
it should
you
be my
go.
requirement to do
There
that.
you go.
Yeah, if only politics weren't so complicated in Florida. Unfortunately, there's we have a lot of things that we have to fight back against in this state.
Issues.
But where would you say that the movement is right now as far as, is there sort of like a deadline you're looking at in terms of when you want to have this completed? Because it looks like you guys kind of have the numbers down in terms of what it would take in order for it to get done. It's really just a question of, have private insurance and big pharma made you sort of an enemy at this point? Do they see you as a threat? And if that's the case, then obviously you're on your way. But it obviously comes down to, can we get, enough non-corporate representatives to step up and support this initiative?
Yeah, well, fortunately, with an initiative, we don't need representatives to do anything. Unfortunately, with our bill, that's what we were running into. In fact, I had a meeting with an elected official recently, and I was told pretty much up front that we've been out-lobbied by the lobbyists, the insurance lobbyists. So,
which we're honest about it, I suppose.
It isn't surprising since we're all volunteers. We have day jobs. We can't just spend all of our time calling these representatives, begging them to do something to save our lives. We have other things going on. We're not paid lobbyists. So that's why I really like the initiative process, though, because it circumvents those elected officials who I'm pretty certain are so sold out to for-profit insurance companies that they'll never let this pass. And then on top of that, if we got it passed through the legislature, then we need Jay Inslee, our governor, to sign it, which I'm not very confident that he would sign any sort of significant universal healthcare legislation. He was responsible for a public option, which, by the way, was not at all a public option. It only is open to people who get their insurance from the exchange. So that's about 4% of Washington state residents, so that's not public. And it also has the HCA contracting with for-profit insurers. So I feel like that's further privatizing our system on the opposite direction that we want to go. So that's, again, why I love the initiative process, because we can just go around them. The governor doesn't have to sign it. So
your problem is COVID. And that's, because normally what would be the easier process is now very much stymied.
Yeah, it's difficult. And we were really excited about potentially being able to collect signatures online, but unfortunately, the challenge to allow us to do so was not passed. So, but we're hopeful that with the vaccine rollout and COVID, I saw some news today that the hospitalizations for COVID have gone down. That hopefully we'll be able to collect signatures very soon. But in the meantime, to answer your question, I'm really, really excited about the potential we have in different states and nationally, because there are groups that are working in different states, like Massachusetts, Maine, New York, California, even Colorado, talking about reintroducing legislation, running initiatives. And I feel like since we're all kind of talking now, and not just in our own echo chamber, in our own lanes, we're actually collaborating with each other in these different states, we have a better chance than ever to get this campaign off the ground in multiple areas.
We are definitely rooting for you. So people, check out Whole Washington. wholewashington.org, support, buy red hats for your friends.
Seriously.
Because depending on where you live, this is really, this could be the closest chance we're going to all have sort of, collectively for a while. So
yeah. And everybody needs to be working in concert, boost Whole Washington. I mean, it's just a great concept.
Spread the word.
Yeah. I mean, this is how it's going to happen. Eventually it just becomes sort of like a breaking the dam type situation. It's no different than how difficult it was to try to get any momentum down here when Jen first started running. And now, because of the success of the campaign, because of the success of the podcast, things eventually start to turn. They just do, because inevitably, your determination to do right by other people eventually gets recognized as not a grift, but actually a virtue. And that's something that I think you guys really stand for very well. I would think a state like Washington is a great place to fight for. It's the right population size, but people are not living on top of each other like they are in other places. So I do think there's a great opportunity to really spread the word as needed in the rural parts as much as in the big city. But again, it's wholewashington.org. We are speaking with Georgia Davenport, political director for Whole Washington.
I was going to say it's Georgia from Washington.
Yeah.
I just think that sounds funny.
Yeah. Well,
actually interesting. There is a city that I live really close to named Davenport. So really? I say Georgia like the state, Davenport like the city.
That's really interesting.
Well, I know Davenport, Iowa, but I guess there's another one.
Well, the truth is there's probably Davenports in a lot of places.
That's true. Well, whoever that's named after.
Well, thank you so much, Georgia, for coming on and talking healthcare with us. I really appreciate it. And well, keep us posted how everything's going.
Obviously this will drop tomorrow. So guys, definitely spread the word. I mean, more and more people to be talking about this issue. Single payer healthcare is the future. Yep. It's just a question of when we get there. But if we all work together, I have no doubt we're going to get there sooner rather than later. So Georgia, thank you so much again. And we hope to see you again soon.
Bye.
Thank you so much for having me on. I really, really do appreciate it.
Absolutely.
Pleasure.
Bye. Thanks for watching. If you want to support our mission to transform politics into service, please like this video, subscribe, follow us on social media, and consider joining our Patreon, where you'll get early access to our interviews as well as other exclusive content. Links are in the description. Peace out.